AccuTite. This is the little odd player of the bunch because it's like, where was this thing useful for? It's tiny. Where can I use it? I love this one. So this is a gross generalization. Hang with me. But if you think about my face type, that's typically the person who is in facelift territory. I'm not saying it has to be. I'm just saying usually. This is the other end of the spectrum. These are the people in my injector's chair that are far away from facelift territory. They're the young females who love 2 millimeters of brow lift that their Botox get them. I love that one. That's a cool trick. Or they have early 35. They just have a little hint of early pre-jowling. Or a little fullness submental. I love this AccuTite because I can do it right where you sit in my injector's chair. I don't even do tumescent. Just numb you up with like 1 or 2 cc's of lidocaine with, and then just treat that skin. It's awesome. That's how AccuTite fits in my practice. So it's a 22 gauge cannula. The size of a 22 gauge cannula. It's the same exact science. So I'm going to blast this as everything else we've talked about, bipolar radio frequency. And I couple it with Morpheus. This is the size. Look how tiny this is. And I can apply this with a tiny little 18 gauge stab. Anywhere in the face. Inconsequential. So if I want to do lateral brow, under eye, nasolabial fold, jowl, submental, just a little stab, and then I treat to endpoint temperature. Same rules apply that we've been talking about. This is the proposed areas, although we can take that AccuTite and I can use it on our armpit roll. I can use it on the top of a knee. So these are the areas that InMode has been toying with, the brow, periorbital, nasolabial. Here's what I would say. You can do periorbital. I wouldn't start there, but yes, you can absolutely do lower lid. There's a lot of high-priced real estate there. If you're not doing lower blephs, I would suggest maybe start in a less high-priced real estate area like submental, before we just jump to that. Or nasolabial fold's a good one. This might be me doing my office manager's lower lids, under local, just a little bit of injection. This is lateral brow. It's awesome, awesome, awesome. Now, time out, friends. Sorry, knees, I gotta tell them this. This is important. This is lateral brow. Aesthetics, we're in aesthetics. Detail matters. This is not the full brow. If you guys treat the full brow, you're going to elevate the full brow, and then everyone's going to walk around looking like they're surprised. That's not sexy. Aesthetics, we want sexy. Lateral brow. So how do we find lateral brow? That's the outside. That's what's attractive. So when you look at your patient, you got to look in central gaze. Central gaze is when your nose and my nose is lined up. We're looking eye to eye. And then I draw a line, a mid-pupillary line. Middle of the pupil straight up to the hairline. Mid-pupillary line, tail of the brow. You treat in between those two lines. That's what you treat. AccuTite, just a little bit of local. Morpheus, 2 millimeters of lift is what I can reproduce time and time again. 2 millimeters is a lot when you're talking about a brow. People notice that. They notice that with your Botox. Some do. If they notice it with their Botox, they will absolutely notice it with the AccuTite. How about that? That's fair to say. So, and then jowl.
Today we're going to be doing an innovative...
This is your internal...
this is evidence of just because you could doesn't mean you should. Do you see the size of this AccuTite? Look at the size of this roll. I would use a BodyTite so I can quickly and efficiently heat this up. Dr. Spiro, by the time 24 hours later that he's finally to tissue temp, I will have long been home, drinking my favorite drink, sitting on my couch watching TV. So just because you could doesn't mean you should. There might be a better tool in the toolbox
This
for
is
you.
your internal...
But yes, you can use the body, but you might be have better opportunities. Okay, this is the lateral bow. It's hard because she's got blonde skin, but just look at her supratarsal crease. This is the supratarsal crease.